Infection control. Please take a moment to review the objectives prior to completing this presentation. First off, a couple of definitions. A pathogen is an organism such as a virus or a bacteria which causes disease. A nosocomial infection is an infection that is acquired by a patient as a result of being in a healthcare setting. Aseptic means literally without germs. These are practices which decrease the number of germs that are present. They do not necessarily mean the same as sterile. The chain of infection is a description of epidemiology, or how disease gets from one patient to another. We start with a host, or a source patient. First, there has to be a way for the pathogen to get out of the host. It may be via blood, or respiratory droplets, or by simple contact of the skin. Once the pathogen has exited the reservoir, or the host, there has to be a way for it to get from the first host to the new patient. And then once it gets to the new person, there has to be a way for it to get into the new host. And finally, the new host has to be susceptible to the organism. To stop the spread of germs, you simply have to do something to break the chain of infection. Hand washing, use of aseptic techniques, protective barriers, and isolation protocols keep the pathogen from being transferred from one host to the next. A host who has proper immunizations, gets plenty of food and rest, moderate exercise, and takes medications as required, is less susceptible to most pathogens, and therefore will break the chain if they don't get sick and become a new source. Keeping clean is probably the best way to keep from spreading any kind of disease. According to the CDC, proper hand washing is the single most effective step in preventing the spread of disease. It's important to keep work areas properly decontaminated. You should disinfect the area at the beginning and end of every shift, plus you should clean up any spills that occur as soon as they occur. Remember also, anything that touches a contaminated surface should be considered contaminated. So if you're using pens or pencils or anything else while you're out doing your job, and you are using them in a contaminated area, you shouldn't take those home with you. They should remain in the lab. Clean areas are areas which are designated to be kept free of specimens and contaminated material. These include the break room, the cafeteria, and bathrooms. Most administrative offices are also required to be clean areas. Proper hand washing technique will be shown in a short video on the next slide.
Okay. All right. I take the paper towel, turn on the water, wet your hands, plenty of soap, then 20 seconds, and that's about as long as it takes to sing Happy Birthday twice. Make sure you wash the front, the back, between the fingers, get the thumbs real good, rotate the tips of your fingers on the inside of your hand. Okay, at the end of 20 seconds, I'm going to rinse the hands with the fingers pointed down. And keep in mind that the rubbing motion does as much of the job as does the soap. Take paper towels, dry your hands. Then use a paper towel to turn off the water. And Barb has very clean hands.
Personal protective equipment includes gloves, gowns, eyewear, masks, and shoes. Gloves should be worn whenever patient samples are handled or whenever dealing with patients. Change gloves when they become visibly soiled and anytime you switch patients. Do not touch clean items with gloves or wear gloves in clean areas. I had a student one time who would insist on texting while in lab, and it just grossed me out because there's really no way to get a cell phone clean. You should always wash hands after removing gloves. Gowns or lab coats should be moisture resistant and should cover from neck to knee. You should wear these while in contact with patient samples and with patients. You should not wear lab coats into designated clean areas. Eyewear is available whenever there is a risk of splash hazards. Normal vision glasses are acceptable in most cases, but specialty safety eyewear is also available and should be provided when necessary by your employer. A mask is used anytime you suspect aerolization of a specimen. In other words, the specimen sprays into the air. You should also wear a mask when exposed to a patient with contagious respiratory diseases. If you have a cold or suspect you may have the flu but cannot avoid working, you may want to wear a mask as not to spread the infection amongst the patients. Currently, HIV and hepatitis are the major diseases of concern, but remember there could always be something else coming down the road that's even worse. These viruses are present in blood and other bodily secretions. It is recommended that all healthcare workers be immunized against hepatitis B. There is currently no working vaccine for HIV or HCV. The greatest danger for transmission is the handling of contaminated sharps. Remember, a glove will not stop a needle from piercing your hand. Universal precautions basically say to treat all patient specimens as if they are capable of transmitting disease. Tier 1 standard precautions. These are practices to be followed regardless of patient diagnosis or disease. And remember, what a patient is in the hospital for or coming to see the doctor for may not be the entire story. Patients are rarely admitted with HIV. They're generally admitted for pneumonia or infection or whatever is bothering them that particular time. This doesn't mean that they don't have anything else. Tier 1 standard precautions encourage the use of hand washing and the proper use of PPE to decrease transmission of diseases through bodily fluids. These practices apply to blood, all bodily fluids except for sweat, non-intact skin, and mucous membranes. Tier 2 precautions are based on what is wrong with the patient. Strict isolation patients are diagnosed with a highly contagious disease. They must be put into a private, closed room with a negative airflow. When you are dealing with the patient, you must wear a gown, mask, and gloves, and all equipment must be disposed of in the patient room. Enteric isolation is used for patients with intestinal pathogens. This requires the wearing of a gown and gloves, and there are special waste containers in the room for discarding contaminated items. Contact isolation is for infections that are spread by direct contact. You will be required to wear a gown, gloves, and mask when you're in these rooms. Respiratory isolation is for respiratory diseases that are spread by airborne droplets. Once again, the patient must be in a closed private room with a negative airflow. Anyone entering the room should wear gloves and a mask. Protective isolation, or reverse isolation, is used for patients whose immune system is compromised. At this point, it is not to protect the healthcare workers from what the patient has, but to protect the patient from anything a healthcare worker might be carrying. Often these are oncology patients whose white counts have been depleted severely by chemotherapy. You are required to wear a gown, gloves, and a mask when entering these rooms. There are a few general rules of lab safety. Avoid contaminating the outside of containers during specimen collection and handling. If you do contaminate the container, you should wipe it off with a disinfecting wipe. Lids should be securely fastened to avoid leaks. You should not apply cosmetics, including lip balm, in the laboratory, nor should there be any eating or drinking around specimens. This should be done only in clean areas. PPE should be worn properly and at all times as indicated. Contaminated PPE should be immediately removed and replaced. Use proper caution when handling needles and other sharps. It's not such a big deal in this day and age. There are a lot of safety devices which help us, but you should never bend or break the needles or recap needles if at all avoidable. All sharps must be discarded in a biohazard puncture-proof container. Decontaminate work surfaces after work is completed or anytime contamination occurs. Use a 1 to 10 dilution of bleach or other approved germicide. Make sure to read the instructions carefully. Most germicides need to remain wet and in contact with the surface for a period of time in order to be properly effective. The time may be as short as 5 minutes or as much as 30 minutes. Many hospitals and other medical settings have gone to using decontaminating wipes instead. These are alcohol-based and dry in a moment or two. You should always allow things to dry naturally and not wipe them dry. The germicide needs to stay in contact with the germs in order to be effective. You should always wash your hands after removing your gloves, between patients, and always before leaving the lab. You really don't want to take the germs to lunch. Do not store personal items in contaminated areas. Don't keep your lunch next to the specimens in the lab refrigerator. And don't handle your cell phone with dirty hands. If you've been wearing gloves, you shouldn't be picking up your cell phone at all. A lot of times people don't think of shoes as personal protective equipment, but they really are. They should be comfortable, rubber-soled so that they don't slip on slick floors, and they should cover the entire foot. No sandals, open-toed shoes, or clogs. Just think about if you were to drop a needle on your foot, would your shoe stop it from poking you? Long hair should always be secured away from the face to keep it from falling into the work area. Avoid excessive jewelry. Other than a basic ring, your watch, and perhaps some stud earrings, you shouldn't wear much jewelry while you're performing phlebotomy. Number 1, the jewelry may dangle into the area. Number 2, patients may grab something which is dangling, and especially if you wear a lot of large or complicated rings, these can tear through gloves and can provide a place for germs to harbor. Nails should be neatly trimmed. Excessively long nails may interfere with the performance of tasks and may harbor germs. Again, you also are at risk of cutting through the glove. The 4 B's of laboratory safety just about cover it all. Be alert, be observant, be careful, and be clean.